during a visit from his home state of Alabama to the Florida Panhandle with his wife Beverly. In August 2024, 70-year-old William Bryan suddenly experienced searing lower abdominal pain. The couple went to the Ascension Sacred Heart Emerald Coast Hospital in Walton County, where he underwent testing for a suspected abnormality in his spleen. At the urging of doctors who told Bryan that he could experience serious complications if he left the hospital, the senior citizen agreed to undergo emergency surgery despite initially being reluctant to consent to the operation. General Surgeon Dr. Thomas Shaknovsky reportedly told Bryan that his spleen was 4 times its normal size and that it had moved to the other side of his body, but something went terribly wrong and the consequences were fatal. According to a lawsuit filed by Beverly, Shaknovsky accidentally removed Bryan's liver rather than his spleen during a procedure called a hand-assisted laparoscopic splenectomy, leading to immediate and catastrophic blood loss, resulting in death. The lawsuit also accuses Shaknovsky of mislabeling the removed organ as a spleen, noting that it was only properly identified as Bryan's liver after his death. The law firm representing Beverly, Zarzor Law, claims that Shaknovsky had previously performed another wrong-site surgery when he allegedly removed part of a patient's pancreas while attempting to perform an adrenal gland resection. The case was settled under undisclosed terms, and Shankowski continued to operate on patients. Beverly is hoping to change that through the ongoing legal action against the surgeon, who appears to no longer be practicing at the hospital where Bryan died, but has not lost his license to practice. Number 15. Jade Crabtree. In 2019, a 19-year-old British teenager named Jade Crabtree sought treatment for swelling in her leg. A doctor diagnosed her with a repetitive strain injury nicknamed housemaid's knee. The condition is caused by repetitive kneeling, which Crabtree found strange, since she worked a desk job and didn't engage in any activities that would typically result in excessive leg strain. She insisted that something more serious was going on, but several subsequent doctors' visits went by before her provider realized she was suffering from a rare type of bone cancer called osteosarcoma. After undergoing 2 rounds of chemotherapy, Crabtree learned that she needed to have her leg amputated in order to stop the cancer from spreading any further. She defeated cancer and now relies on a prosthetic, but reportedly still struggles to come to terms with her new reality. Despite the delay in receiving her diagnosis, Crabtree has not accused her treatment team of any wrongdoing or taken any legal action against them. In fact, she has expressed gratitude toward her providers for their commitment to her care and continues to navigate the complex process of adjusting to life as an amputee. Number 14. Cheyenne Medrano. A trip to Mexico for plastic surgery ended in tragedy for a 31-year-old Houston mother and at least 3 other women from Texas in recent years. In March of 2023, Cheyenne Medrano traveled to the state of Matamoros for liposuction and a Brazilian butt lift, or BBL for short. She was lured across the border by the cut rate prices that are offered by Mexico's plastic surgeons, which American providers simply can't compete with. Things took a catastrophic turn shortly after the procedure when Medrano began complaining of headaches. Her condition rapidly deteriorated over the next 2 months as she suffered multiple strokes, ultimately leading to her death from fungal meningitis in May of that year. Medrano was one of 4 women who had recently died from the infection after going under the knife in Mexico. She and one of the other known victims were operated on by Dr. Luis Manuel Rivera de Anda, who is listed online as a gynecologist rather than a plastic surgeon. On his Instagram, he advertised full liposuction, a BBL, and breast augmentation for just $5,000, along with before and after photos of his work. While there was no proof that Dr. Rivera de Anda's actions had anything to do with Medrano or any other patients suffering from fungal meningitis, the correlation of his patients suffering the illness was enough to send US government officials into somewhat of a panic. While there were only 4 known patients who had recently died following plastic surgery, In Mexico, American authorities believed that hundreds of more patients were at risk. According to the U.S. Centers for Disease Control and Prevention, around 230 Americans had traveled to clinics in Matamoros so far that year and were thought to be at risk. As a result of the 4 deaths, the agency urged patients to go to the emergency room immediately for an evaluation, even if they were not experiencing symptoms of fungal meningitis. Number 13. Fernando Cluster. In September of 2022, 62-year-old Fernando Cluster checked into a hospital in Atlanta, Georgia with an intracerebral hemorrhage, or what's commonly known as a brain bleed. To reduce the pressure on his brain, doctors determined that they would need to remove a 5 by 7-inch portion of Cluster's skull. It was a routine procedure, but when Cluster returned to the hospital 2 months later to have the piece of skull reattached, staff members couldn't find it. It reportedly got lost among a collection of other unidentified bone fragments that had been taken from patients' bodies and were being stored in a freezer. An employee noted in Cluster's medical file that there were several bone flaps with incomplete or missing patient identification, but we could not be certain which, if any of these, belonged to Mr. Cluster. Left with a large indentation on the right side of his head, Cluster had no choice but to wait while the hospital created a synthetic skull piece to replace his missing bone. The newly fashioned piece was implanted without any initial complications, but the hospital billed him for $19,000 for the synthetic skull piece that they had to fashion as a result of their own mistake. To make matters worse, Cluster suffered from an infection following the operation and had to undergo additional surgery, leaving him unable to work while he received the care he needed. When all was said and done, his bill totaled nearly $150,000, and the hospital did not offer to cover any of the costs. Cluster is currently in the process of suing the hospital in hopes of receiving compensation for his medical expenses. Number 12. Ilya Lonkar. While working as a waiter on board the Norwegian breakaway cruise ship, 30-year-old Serbian national Ilya Lonkar began experiencing nausea and other flu-like symptoms. He visited the ship's doctor, Sebastian Campuzano, who injected a large dose of the antihistamine promethazine into Lonkar's right arm. Lonkar complained of a burning sensation in his arm, but Campuzano continued to administer injections. A few hours later, Lonkar's arm began turning black and blue from gangrene. His condition continued to deteriorate, and by the time he finally reached a hospital in Miami 20 hours later, it was far too late to save his arm, giving doctors no choice but to amputate the limb. Lonkar sued the cruise line, arguing through his attorney, Thomas Scolaro, that Campuzano was inexperienced and had administered an inappropriately large dose of the medication. Moreover, the lawyer claimed that Lonkar had received an inappropriate medication for his illness and that it should have at least been injected into his buttocks rather than his arm. Records show that Lonkar received injections totaling 25 milligrams when the average recommended dose is just 6.25 milligrams. According to Scolaro, his client was treated with a dangerous drug for a very simple, common problem that can be treated with very light and easy medication. He followed up his claim by pointing out that the U.S. Food and Drug Administration had previously issued warnings about the medication's tendency to overwhelm vascular walls and damage tissue, resulting in numerous documented amputations in the past. To drive his point home, Scolaro likened Campuzano's treatment to taking a howitzer to destroy something when all you need is a little BB gun. In September 2018, a jury ruled in Lonkar's favor, awarding him a $4.6 million settlement for his claim. And while it won't bring his missing arm back, the money will help him afford any continued treatment he needs, along with a baseline quality of life that his inability to continue working as a waiter had taken from him. Number 11. Ian Patterson. Over a 14-year period lasting from 1997 to 2011, a British breast surgeon named Ian Patterson reportedly performed botched and unnecessary procedures on more than 1,000 women. During that time, he worked with cancer patients at hospitals in England's West Midlands region, where he performed so-called cleavage-sparing mastectomies as part of the unregulated procedure. Patterson left tissue inside patients' bodies, which led to their cancer returning. Meanwhile, other women underwent unnecessary operations, with some finding out years later that they never even had cancer. According to reports, Patterson even went as far as claiming that the region he was working in was a cancer hotspot, as a way to explain the unusually high number of surgeries he was performing. In many cases, he overcharged for the work he performed, indicating that his crimes were at least partially financially motivated. Concerns about Patterson's treatment were raised as early as 2003, and an independent inquiry later found that he was allowed to continue practicing due to a culture of avoidance and denial. He was finally held accountable for his actions in 2017, when a jury found him guilty of 17 counts of wounding with intent. As a result, he was sentenced to 20 years in prison. The convictions pertain to cases involving 9 women and 1 man, representing just a tiny percentage of the total number of people Patterson harmed. In the years since, dozens of additional investigations have been launched in an attempt to measure the true extent of his malpractice and to obtain justice for the rest of his victims. These efforts are ongoing, with the most recent batch of 8 inquiries being launched in September of 2024. Number 10. Molly Harbron. In April of 2020, 22-year-old Molly Harbron went to an emergency room in Dewsbury, England, with numbness and coldness in her left leg and foot. She was also experiencing pain in her calf, and her left foot was discolored. Harbron was prone to a condition called diabetic ketoacidosis, and it was cutting off the blood supply to her leg. But doctors failed to carry out the tests needed in order to make a proper diagnosis, resulting in a delay in treatment which ultimately caused the need to amputate the young woman's leg. Bosses at the hospital later admitted that Harbron's leg may have been saved if she had undergone surgery by 9 p.m. on the day she checked into the hospital, but surgeons didn't operate on her leg until 1:30 p.m. the next day, and by then it was far too late to restore the blood flow to the limb. Harbron initially underwent a below-the-knee amputation, but experienced complications which required doctors to amputate above the knee. As a result of losing her leg, she was forced to give up her job as a caretaker. The physical and mental impacts of the amputation also took a toll on her once extremely active social life and her independence in general. And although she's able to walk with the prosthetic, she says that it becomes painful to use, so she typically relies on a wheelchair. Despite the challenges she faces, Harbron remains focused on moving forward with her life and is facing her obstacles head-on. She refuses to let her setbacks get in the way of her accomplishments, which include marrying her soulmate in 2023. Number 9. The Elephant Man Trial. In March 2006, 8 healthy young British men volunteered to receive an anti-leukemia medication as part of a drug trial in London. In exchange for more than $2,600 each, 2 of the men received a placebo, while the other 6 quickly became plagued by excruciating pain, headaches, vomiting, incontinence, uncontrollable shaking, and other horrifying symptoms. They felt cold as their organs began to shut down, and their faces became extremely bloated as they drifted in and out of consciousness. Britain's National Health Service immediately sprang into action after learning that the volunteers were essentially dying. Thanks to the diligent efforts of the agency's doctors, all of the men survived. Although the recovery was worse for some than it was for others. One man lost his fingers and toes to gangrene, and all of the volunteers spent time in a hospital, with the sickest man being laid up for 4 months. Medical trials are a routine practice in the UK, and nothing like this had ever happened before, even in cases where volunteers had experienced adverse reactions. Nicknamed the Elephant Man trial for its temporarily disfiguring effects on the volunteers' faces, the Botched test run quickly became a media sensation while investigators worked to determine why the medication had made the men so sick and in such a short amount of time. The volunteers had received a German-designed drug called TGN 1412, which seemed to have the potential to cure leukemia and rheumatoid arthritis by superboosting the immune system. It had performed well in animal trials, but in what's known as a cytokine storm, the drug had triggered a massive release of inflammatory molecules called cytokines in the human subjects. In a nutshell, the volunteers suffered an over-response of the immune system. According to an update from 2017, roughly 11 years after the Botched trial, none of the men had experienced any long-term complications stemming from the incident, but it remains a possibility, and the volunteers are still left to grapple with the mental trauma caused by their experience. Number 8. Sarah Gomez. 39-year-old mother of two, Sarah Gomez of Alcantarilla, Spain, was left with holes in her organs after undergoing a $6,500 liposuction procedure in Cartagena in late 2021. Shortly after the procedure, the surgeon told Gomez's family that the operation had gone according to plan, but that the woman was losing a lot of fluid and her treatment team was working to stabilize her. 3 hours later, she was admitted to the emergency room in a state of what's known as hypovolemic shock, which is caused by severe blood loss and dehydration. She spent about a month in the intensive care unit before ultimately succumbing to her injuries. Gomez was reportedly covered in injuries like she'd been in a knife fight. When she first arrived at the hospital, she suffered several serious injuries as a result of the botched liposuction procedure, including holes in her kidney, liver, duodenum, colon, and intestine. An attorney representing the woman's family, Ignacio Martinez, said that his law firm deals with a lot of plastic surgery-related cases, but that what happened to Gomez was incomprehensible in comparison to the typical case. At the time, the family had yet to file a formal complaint against the unnamed surgeon who performed the surgery. The outcome of the case is unclear. Number 7. Tom Hadries. "I'm terribly sorry, we made a mistake," are words that no one wants to hear upon waking up from a medical procedure, but that was the reality experienced by a retired British engineer named Tom Hadries when he woke up in the recovery room after undergoing a hernia operation in Brighton, England in 2016. While driving home after the procedure, the surgeon realized that a medical specimen bag had been left in Hadries' abdominal cavity, along with a piece of bowel that had been removed. He drove back to the hospital, where he explained the mishap to Hadries before putting him back under for a secondary procedure to remove the contents from his body. The hospital later acknowledged its mistake and that the error prolonged Hadries' recovery, and in 2020 he was compensated around $20,000 for the mishap. But Hadries claims that he continues to suffer as a result of the botched procedure, which left him with a weak abdomen and an inability to lift heavy objects, and the surgeon responsible for the error reportedly still works at the hospital, despite the facility's managers classifying the incident as a never event, as in something that should never happen. According to BBC News, even some of the surgeon's colleagues questioned his competence and didn't think he was qualified to continue operating. Furthermore, in 2019, a complaint resulted in an investigation which concluded that there was no case to answer and no action required regarding the surgeon, whose capabilities were called into question yet again in 2022. Once again, an inquiry found that no further action was needed and he continued to operate. This is just one of more than 100 cases of alleged medical negligence involving two surgery teams at a group of hospitals called the University Hospitals Sussex NHS Foundation Trust. Despite these complaints, which are reportedly under investigation, a foundation spokesperson insisted that patient safety and quality of care remain top priorities, and that immediate corrective action is taken when a mistake is made. Number 6. Lisa Maria Carter. In 2010, a Florida woman named Lisa Maria Carter developed a massive infection after undergoing a fairly routine procedure to have a benign ovarian cyst removed. As a result of the infection, she lost both her arms and legs, forcing her into early retirement after spending her career working as a civilian intelligence analyst for the Department of Defense. She also lost her independence and was relegated to living in a nursing home where she spent her final years fighting for justice over the alleged medical mistake that she believed led to her condition. In a lawsuit against the University of South Florida's College of Medicine, Carter accused Dr. Larry Glazerman of puncturing her small bowel and failing to notice the mistake. She blamed the doctor for causing the infection that led to her being a quadruple amputee, arguing that her limbs might have been saved if he had caught his error in a timely fashion. Glazerman denied responsibility for Carter's condition, arguing that he would have noticed if he had nicked her small bowel during surgery. After 2 trials ended in a hung jury, a third jury sided with Carter and awarded her a $109 million settlement, but the USF appealed the case and the decision was overturned. In 2020, Carter passed away in 2022 while awaiting her 4th trial. Number 5. Richard Stayskull. In 2018, a U.S. Army Green Beret received the devastating news that he was suffering from terminal lung cancer. 37-year-old Sergeant First Class Richard Stayskull, who was stationed at Fort Bragg in North Carolina when he received his diagnosis, which he argued should have been detected and treated much earlier on in his care. Speaking with local station WTVD-TV, he said that his tumor festered and grew for 6 months, while his medical providers took no action. Stayskull's symptoms began in early 2017, shortly after he was cleared by a military doctor to move forward with dive team training. A lung scan had been taken as a standard part of the procedure to qualify candidates for the program, and as far as Stayskull knew, everything had checked out. Shortly thereafter, however, Stayskull began to experience an inexplicable shortness of breath, along with wheezing and coughing, which landed him in the emergency room. Doctors suspected pneumonia but were admittedly unsure of what was going on, and they sent Stayskull home. Months passed before Stayskull finally learned what was really wrong with him, by which point he had started coughing up blood and suffering other terrifying symptoms. A biopsy revealed the tragic news that he had cancer and would not survive, and a closer look at his medical records revealed that military doctors had discovered an abnormality in a CT scan of his lungs after he initially raised concerns about his health. The alleged oversight prompted Stayskull to fight for legal changes which would help to protect other soldiers who land in unfortunate medical situations. Under a 1950 law known as the Ferris Doctrine, active duty military members are prevented from suing the US government for malpractice. As a result of his efforts, lawmakers passed the Stayskull Act in 2019, which allotted the Department of Defense millions of dollars for medical malpractice claims. But Stayskull's malpractice claim has been denied repeatedly, with one decision ruling that the providers who treated him had not adversely affected his chances of survival. His cancer has since progressed to stage 4, and his fight for justice continues. Number 4. John Agins. In February of 2022, an assisted living facility in Tallahassee, Florida, asked Dr. John Agins to prescribe the laxative Bisocodyl for a 94-year-old woman who suffered from severe constipation. But a misclick on the electronic prescribing system led to him accidentally writing a prescription for a cardiac medication called bisoprolol fumarate. The patient died as a result of the mix-up, prompting the Florida Department of Health to investigate. According to an administrative complaint by the agency, the patient received the bisoprolol fumarate for 3 days before suffering septic shock from left toe necrosis and pneumonia. She passed away 3 days later, leading to the discovery that agents had prescribed the wrong medication. The doctor had no previous disciplinary issues on his record, but was accused of failing to double-check the prescription before he submitted it, which proved to have life-ending consequences for the recipient. Number 3. Jade Hart. 33-year-old first-time mom Jade Hart died just hours after giving birth to her son Hugo in July of 2018. The tragedy occurred in the middle of the night at Bassett Law Hospital in Worksop, England, where Hart's treatment team overlooked a rare complication known as a uterine inversion. An inquest carried out by Nottingham Coroner's Court found a doctor and a midwife to be directly responsible for the tragic mistakes that led to Hart's death. According to an official report detailing the findings, Hart suffered several cardiac arrests leading up to her death, which would not have happened if the staff had detected and treated her uterine inversion. Moreover, Hart experienced a hemorrhage as a result of her providers failing to perform regular checks on her condition. The bleeding triggered organ failure and brain damage, which contributed directly to her death. Hart had collapsed within an hour of Hugo's birth, and she did not survive for very long after that. Furthermore, the inquest found that Hart's request for an epidural, which was denied due to high blood pressure, should have been granted. According to one expert who testified, the provider's care fell far short of the most basic expectations, causing concerns that history could repeat itself at their hands in the future. The healthcare leaders who carried out the inquest vowed to make necessary changes to prevent a similar incident from happening again, but it's unclear whether the medical providers who treated Hart are still practicing. Today's topic was requested by Peng Wing 638 and Dragon Master 3315. If you have any other topics you'd like to learn about, subscribe and let us know in the comments section below. Number 2. John Bradley Williamson. In 2021, concerns were raised regarding the conduct and capability of a British spinal surgeon in his 60s named John Bradley Williamson. A review of his treatment of 130 patients over a 5-year period, lasting from 2009 to 2014, revealed a laundry list of troubling errors. According to the investigation's findings, Williamson had misplaced screws in the spines of 23 patients, caused 5 patients to suffer excessive blood loss, and failed to investigate or act on post-surgery complications in a timely way, if at all. In 9 cases, one of the surgeon's most famous patients, actress Ruth Madeley, told the Sunday Times that she suffered from chronic pain and a twisted body after undergoing 9 scoliosis operations under Williamson's care. This is especially troubling considering the fact that Williamson was once the president of the British Scoliosis Society. Further colleagues described Williamson as incompetent and a bully of sorts who ran a toxic team with absolute power. The agency also found that the surgeon directly contributed to the death of a wheelchair-bound patient named Catherine O'Connor, who passed away on the operating table in February 2007 from blood loss during an operation for spina bifida. At least 3 other patients reportedly died under Williamson's care as a direct result of his treatment, while 7 others suffered severe harm. According to the most recent updates, Williamson is no longer performing surgery but continues to see patients privately while reviews into his past conduct continue. Number 1. Stephanie Aston. 33-year-old New Zealander Stephanie Aston suffered from a rare genetic order called Ehlers-Danlos syndrome, or EDS. Her symptoms began in 2015 at the age of 25, when her health mysteriously deteriorated without any obvious identifiable cause. But in 2018, a doctor she sought treatment from accused her of faking her illness, instead diagnosing her with what's known today as a factitious disorder, once called Munchausen's factitious disorder is characterized by a physically healthy person's deliberate efforts to make themselves appear sick or injured. EDS runs in Aston's family, and she legitimately had the disorder, but her claims of suffering fell on deaf ears. To make matters worse, she suffered from one of the more serious forms of the illness, which according to the Mayo Clinic can cause the walls of your blood vessels, intestines or uterus to rupture. Aston complained to the authorities about her misdiagnosis, noting that it affected her ability to obtain effective treatment for the anemia that was caused by her illness. At the same time, she became a vocal advocate for the EDS community due to her efforts to raise awareness and dispel misunderstandings about the disorder. But her anemia was nevertheless deemed self-inflicted, and she was involuntarily committed to a psychiatric ward for observation in an apparent effort to prove that she was purposely making herself sick. Aston's efforts unfortunately failed to get her the care she needed, and she died at her home in September of 2024. The tragedy is helping to shed light on the misconceptions surrounding EDS and the tendency for doctors to misdiagnose patients due to the disorder's wide array of confusing symptoms. Thanks for watching. Would you rather have your appendix removed by a drunk doctor or fly across the Atlantic on a plane with a drunk pilot and co-pilot? Let us know in the comment section below.